All right. Hello. Good afternoon, everyone. My name is Dr. Cecilia Stopis, and I am the medical director at MIT Medical. And I'm here with a number of people from our team at MIT Medical, and we are going to introduce you to MIT Medical today. Congratulations, first of all, to all of you who are joining us, because if you are joining us on this call, it means that you have someone that you care about who is intending or thinking about coming to MIT. All right, so getting started, I'll just start with reviewing the agenda. The next slide. We will do some brief introductions, and then we will go over our clinical services at MIT Medical. We'll spend some time on our student mental health and counseling service, our student health insurance plan, our community wellness program, and then we'll leave ample time at the end for question and answer. Please, if you do have questions and answers, we ask that you put them into the Q&A section of the Zoom webinar, and we'll do our best to answer them either sort of in real time or later towards the end. Okay, so on the introduction front, so as you can see, I am Cecilia Stopis. I am the medical director here at MIT Medical. I'm also an alumna of MIT. I'm married to an MIT alum, and I have a daughter who's an MIT alum. And so my ties to MIT run deep, and now I work there too. So as the medical director, I am responsible for all of the services that are provided by MIT Medical to the MIT community, inclusive of our students, faculty, staff, their dependents, and retirees. So I will stop there. I'm going to hand it over to Dr. Sean Ferrulo, and then you'll hand it on from there, Sean. Thanks.
Great, thank you, Cecilia. Do you want to, Cecilia, want us to do a round of introductions and then we'll get in, or just
round of introductions. Just
Perfect.
Introduce yourself.
Yep. Sorry about that. As Cecilia mentioned, my name is Sean Ferrulo. I'm a family medicine, sports medicine physician. Been at MIT Medical since 2005. I am the associate medical director on our medical services, and we'll get into a little bit of all of those offerings and oversee our student health functions as well. So maybe from there, Tony, I'll hand it off to you.
Yes, thank you, Sean. My name is Tony Lim. I am an adult psychiatrist by training, and I'm also the deputy chief at student mental health and counseling here at MIT Medical. I've been at MIT for a little over 5 years now. And maybe you'll pass on to Brian.
Sure. Good afternoon or good morning if you're in quite a far away time zone. I'm Brian Sheets. I'm the executive director of MIT Medical with responsibility for all of our administrative functions. In addition, I oversee our student health plan offering, and hopefully we'll learn more about that today. And so let me introduce Caitlin McCourt from our community wellness team.
Hi, everyone. I'm Caitlin McCourt. I work as the Director of Community Wellness at MIT Medical, and our team involves full-time staff members, and we also work with wellness instructors and acupuncture providers, and I'll tell you more about our service in a bit. I'll pass it along to my colleague, Greg Baker.
Hi, everyone. Yes, Greg Baker here, and I work with Caitlin in Community Wellness, and I am clicking delicately behind the scenes for your slideshow today. So thank you for being here. Shayla, are you able to introduce yourself?
Can everyone hear me okay? Good. Hi, my name is Shayla Sanchez. I am the team lead over at the Student Health Insurance Office. We are a team of 5, and our office is where students would go to either waive the insurance or, learn more about the insurance that they're on.
All right, so thank you everyone from the team that's joined us today, and thank you again to all the folks who are joining us from everywhere else. Next slide, please, Greg. Thank you. We just thought we might want to start off with telling you where MIT Medical is. Now, what you are looking at here is a portion of the map of MIT. And Greg, could you just put your cursor over to where the Great Dome is down in the lower left-hand corner? So that is the iconic Great Dome of MIT, right more or less in the center of campus, give or take. And you'll see that we are east of that, right outside the brand new, beautiful Kendall Square T-Stop. That is where MIT Medical is located. So We are in a building that has been in operation in this location. MIT Medical has been in operation in this location since I think 1982. So we are well versed in the local neighborhood and ready to serve you when you get to campus. So I think from here, I'm handing it on to Dr. Ferrulo, who's going to talk about the medical services we offer.
Yeah, thank you, Cecilia. And we'll do a brief overview and make sure we have time for questions. As people know, I think my famous line, and everyone on our side of this conversation has heard me say this, you know, certainly MIT is a community. We have a credit union, a police department, and we have a community health center. I think that is the best way to think of MIT Medical. As Dr. Stopis mentioned, we do take care of faculty, staff, students, and family members of MIT employees. So we're a little bit more than your standard campus health, student health only function, but student health and care of our students is core to our mission and what we do. Within this, our hours of operation, so we do have a primary care service where our community members can get continuity care and ongoing care. Our primary care office or function is weekdays, Monday through Friday, 8:30 to 5 p.m., similar to other ambulatory practices. Embedded within that, we do have a same-day care, walk-in care service, urgent care department that is located on the first floor of our building that is open from 8 a.m. to 8 p.m. During the business days, and then 10 a.m. to 4 p.m. on weekends and holidays. We have only 4 closure dates throughout the entire year, and they're specifically designed around times where students are not typically on campus. So New Year's Day, 4th of July, Thanksgiving Day, and December 25th, or Christmas Day. We do, one of the pieces to emphasize is have 24-hour service by phone, even if our department is closed. So these following numbers here are also quite important. We have an answering service, a nurse on-call system, and a provider on-call if needed. So the urgent care phone number is the number that is best to be answered 24 hours a day. If it's not a connected individual and there's a triage question or a question about what to do. So that is 617-253-1311. We oftentimes will review these with our students during orientation and even plug for them to put it into their contact list on their phones so that if something comes up in the future where they didn't think they would need us, but then they do, they know where they can find that number. And of course, you can find it online as well. And our student mental health and counseling service during the daytime is listed here, 617-253-2916. And then in the evenings or at nighttime, it also converts over to our answering service. And we have a pretty robust answering service for the behavioral health issues as well that can give guidance and advice as well. Greg, if we could go to the next slide. So just to give a scope, the picture that you're seeing is our building of MIT Medical with the door on the right side or kind of straight up the avenue there. We do, as mentioned, have a full scope primary care service and urgent care service. We also, and I'll let Tony, Dr. Lim give a little more information on the student mental health and counseling service. Since we do take care of a broader population as well, we have an OBGYN department that also is robust in those services. We have X-ray and a full service lab on site within our building. We have an eye service, a sports medicine and orthopedic department. There is a dental service, and then our community wellness team, which is listed, or Caitlin will speak about in a little bit. And more. We frequently are partnering with our community, with our campus partners and others around needs for the community. So Greg, if we could go to the next slide. So I think as people can imagine, this slide was quite important a few years ago and quite robust. Our current stance at MIT can be found at the now.mit.edu webpage, where MIT is keeping the most current and accurate up-to-date information. On campus, masking is optional. For those that wish to mask, it is not mandatory, except in areas where in the Commonwealth of Massachusetts, the Department of Public Health does require all medical facilities that all individuals have to be masked in the building still at this time. And also our animal research facilities have that requirement as well. And Greg, if we go to the next slide. One piece just to touch on always, that's not unique to MIT, but certainly for student health, and certainly as all of us who have children who are converting into 18 years old, where the legal aspects see them as adults. We do and are required to follow all federal and state confidentiality rules in terms of disclosure, protected health information. With that said, students and all patients can give their clinician or their nurse permission to speak with parents or others about their specific episode of care. We are always happy to partner with families, and oftentimes we'll work with students to see if they have questions or would like us to help partner. But there is not a blanket permission. There is not a consent form for full access to all records at all times, as there are not in other areas of healthcare within the United States. But that last bullet will highlight again, we are certainly always happy to partner, always happy to engage families and parents in conversations with the student's permission, and to help coordinate their care as well. Next slide. All right, Dr. Lim, I will hand it over to you here.
Thank you, Sean. I'm going to talk a little bit briefly and give you an overview of the services for student mental health and counseling. As the name implies, we are focused, our department within MIT Medical is focused on students, both undergraduate and graduate students. And we offer a multidisciplinary integrated care, meaning that we have the ability to provide medication management as well as psychotherapy to our students on site. As a college counseling center, we're ideally situated to provide short-term individual therapy. We both do initial medication evaluations and ongoing management. So if your child is already on medication and needs to transition their care to us, we have the ability to see them within MIT Medical. We also offer a robust group counseling program that supplements individual therapy, and have walk-in services similar to urgent care during our open hours. The students can walk into our service and be seen by a clinician for urgent issues. We also have an ability to help students find referrals for off-campus treatment should they need or want a level of care that is not available here at MIT Medical. That's often students who are engaged in very frequent, like weekly therapy. We have a referral coordinator that can help find someone that is within that work. We can go to the next slide. Okay. So some of the typical things that we see here, which is kind of common across most universities, a lot of anxiety and stress, depression, eating concerns, trauma. Some remote, very common issues that students come seeking help for are relationship problems, sleep problems, and loneliness. The point of this slide is to say that we're able to provide care for a very broad range of mental health issues that students may be experiencing at their time here at MIT. Next slide, Greg. Okay, and let me wrap up. I want to highlight that we have very flexible care here. So we're able to offer both in-person and telehealth options to our students. This is something relatively new since the pandemic, but we have found that students find it very convenient to have an option to see one of our clinicians via telehealth if they can't get into the clinic. I want to put a little asterisk on that to say that we can do that for students when they're within state. We are not able to to provide that kind of care if they're residing out of state at the time of treatment. And just to put things in perspective, you can see on the second line, we roughly see about 25% of the student body each year. And the point of this say that our services are highly used, and it's not uncommon for your child, even if they've never had a mental health issue before, to come seek support with us. And just to also highlight something that Dr. Frullo said earlier, our sessions and visits are confidential. As a parent, you will not be informed automatically if your child is coming to seek help from us. I think this is important for both parents and students to know. So we don't talk with either parents or friends or even administrators and professors without the consent of the student. The exception is, of course, in these emergencies. And I want to close with saying that something that Dr. Frullo said, that we are always very happy to partner with our parents, but it is in collaboration with the students. And with that, I'm going to pass it on to
me, Tony. Thanks. So I'm Brian Sheets, as I mentioned, Executive Director and in charge of our student insurance options. And particularly want to talk, and there's a lot of questions always about this, about our MIT student health insurance plan called MIT SHIP. The best way to think about it, it is a great comprehensive product offered through Blue Cross Blue Shield of Massachusetts. It's a full-scale health insurance plan, like you imagine, with all of the relevant coverage, but it's really specially and uniquely designed to meet the needs of MIT's student population, coordinate care between MIT Medical and the outside, and it's quite competitively priced, in all honesty, because of the relatively young and healthy nature of the population we serve and our ability to develop that product to really meet their needs. Next slide, Greg. So first off, many of you may know that Massachusetts, as well as some other states, have requirements related to having insurance that is good. We call it comparable coverage here in Massachusetts, which means that it includes all of the basic things you would need for insurance: hospitalization, primary care, medications. So it meets all of those requirements, and it is a nationwide PPO network. That nationwide PPO network means it's, of course, usable in Massachusetts, which meets those requirements, but also usable at home when your student might be back on break or the like. It also meets J1 visa requirements if that is important to you as a foreign national. It does not include vision and dental, with the limited exception of something called the Pediatric Essential Health and Vision Benefit. And that's exclusively for individuals under age 19. And it's a pretty small limited bit. So the best way to think about it is this is a health insurance plan that, broadly speaking, doesn't include dental or vision. Now, Massachusetts rules require you to have health insurance. And the way we meet that per state regulation is we automatically enroll your student in the MIT SHIP plan, and we bill the fee to the bursar account. Now, if you have other coverage and that other coverage meets those requirements, that is, it's good coverage that includes all the things required by state regulation, and it includes a good network of providers, hospitals, and other options here in the Boston, Cambridge area, you can waive coverage. The waiver process happens during the summer. You'll receive an email from us and our vendor partners, a company called Gallagher Student Health, and you can waive online by uploading proof of your other insurance. If you don't waive, or you don't upload proof, or if your coverage doesn't meet the requirements. For example, if you have a limited network HMO in California, Kaiser Permanente is a good example, that would not meet the requirements, and your student would be enrolled in the MIT SHIP plan for the full fall semester. Spouses, partners, and other eligible dependents can enroll as well, and coverage begins on September 1st and goes through the full year to end on August 30th of the following year. Next slide for me, Greg. As I mentioned, you can waive if there's comprehensive coverage. What that means includes all of the services that you think need to be included in a good health plan and has network coverage here. We do use a waiver partner, Gallagher Health, and they're going to check not only that you're enrolled, but they're also going to check to make sure that your coverage meets that rule set. We're really not able to provide one sort of per person recommendations in advance. We really have to look at the specific plan when you submit, and there's a big database that helps us to understand that with our vendor partner. But the best way to describe it is if you have a limited network or a local network or a local HMO, you may not meet the requirements. Next slide for me, Greg. Now, that's the MIT SHIP plan. As I mentioned, it's a full-scale, excellent, really great coverage health insurance product that works pretty much anywhere that Blue Cross Blue Shield is accepted in their PPO network. But if your student seeks care at MIT Medical, the vast majority of services that we provide in our clinic are at no additional cost and do not go up against that insurance. It's already included in the tuition that your student is paying or you're paying with them. That includes primary care, urgent care. It includes seeing one of our in-house specialty offerings, some labs or radiology services that we provide in our building, as well as all of the services provided by Tony and his colleagues, Dr. Lim and his colleagues in the student mental health and counseling service. A couple of limited exceptions related to acupuncture. And if in certain cases, if we were to, for example, draw your blood at MIT Medical, but have to send that to an outside lab for processing, that would run up against whatever insurance your student had. The best way to think about it is the vast majority of things at MIT Medical will be no additional cost. Next slide, Tony. As I mentioned, the couple limitations: outside tests, acupuncture, obstetrical care. In addition, if your spouse, partner, eligible dependent enrolls in the MIT SHIP plan, they're also eligible for that no additional cost. And we do include how those are covered, sort of how those are financed in the fee for the non-student dependents. So more questions, if you have questions, very complicated area, and we know it's one that really matters. We think health insurance is one super important way to keep your student healthy and successful at MIT. You can look on the web at medical.mit.edu and go into our health plan section. We can always reach out to our health plan team as well. So thanks. And I think, Caitlin, you're up next.
Thanks, Brian. So as I mentioned before, the community wellness team in our office is located in MIT Medical. So we're on the 3rd floor of the medical building. We work very closely with our clinical providers and all of the staff at MIT Medical and our campus partners. So we really create a network of support and believe at MIT that students' well-being is really core to their educational experience. So we can go to the next slide. Early on in a student's time at MIT, we can really help them stock their toolkit with skills. And these are around the areas of fostering healthy relationships for social support, prioritizing self-care, and establishing healthy habits. And this is our website. It's located on the MIT Medical webpage, and it really provides a comprehensive overview of all of our programs and services. And Greg, if we can go to the next slide, this is really just a screenshot of that page. And you'll see we offer a variety of topics and areas that will really help support students early on in their time at MIT. We help students sleep better, manage their stress, promote physical activity and opportunities to take many mind-body movement classes. And I really wanted to be able to highlight a few of our programs that students are most interested in. So we can go to the next slide. Helping manage stress is an area that we really can help students. We offer many resources and supports. We have mindfulness stress reduction classes taught by instructors. We also have drop-in weekly meditation sessions. Throughout the academic year, students can participate in group coaching workshops around topics like performance, motivation, time management, preventing burnout, hacking your sleep. We have a lot of resources on our website that can be available anytime, anywhere. And we even have a dedicated relaxation line that's very popular on campus. So you can dial 617-253-CALM anytime, anywhere for a short, brief guided relaxation recording. And the next slide. And another program that MIT Medical is really proud to be the sponsor of, and my colleague Greg works very closely with the Medlinks. This is a peer program that offers support for other students. So there's 150 trained student volunteers who are representing and serving as a liaison between MIT Medical and the MIT students. The Medlinks are trained by a lot of campus partners and clinical staff, so they're able to help students navigate what resources and support is available. They're also trained to dispense single over-the-counter medication. And there's Medlinks in almost all of the FSILGs on campus. So we invite you to meet with a Medlink. They're going to be at a lot of the different activities taking place over the next week. And you can also visit the website to learn more. Next slide. And as Brian mentioned, one of the newer services that we're really excited to be able to offer students on the SHIP plan is acupuncture. And this is a service that's available 5 days a week for students. They're eligible for 20 visits per year. And many students come to us for acupuncture treatment, and we get referrals from clinicians, but students don't need a referral to this service. So some of the common visit reasons would be for any sort of muscle pain, like back, neck, shoulder. We have a lot of students who might be referred from Dr. Lim's team and student mental health and counseling around things like anxiety, depression, stress, insomnia, sleep issues, menstrual conditions. I mean, the list goes on for general well-being. And so next slide, Greg. You can find us and connect with us in all the ways in person. We're also on Instagram and Facebook. And we really encourage students to connect with us early on at your time at MIT. We can help you navigate resources. And again, really just stock that toolkit early on in your time, and we hope to see you in the fall. And yep, next slide. A lot of this information is available on the website, and we invite you to visit the MIT Medical website for more information, but we are going to open it up for some questions.
All right, thank you, everyone. I know we've been answering the questions live in the chat. There's an open set of questions around what will happen to this recording. Greg, do you want to just come off camera, come on and let everyone know where they can access this information after we're done today?
Yes, if they want to email, I have an email set up for medical CPW events. It's medical, MEDICAL -CPW at MIT.edu. If you drop a message to that address, I'd be happy to send you the slides that way. We'll also send them through the admissions office, and we do intend to post the video recording on YouTube once we have it captioned.
Yes, we do have to have it captioned for those who aren't, have hearing difficulties. So we do that professionally so that it meets really good standards for this type of media content. So okay, I'm looking again to see if there's any other questions. Is there a pharmacy at MIT Medical? No, we do not have a pharmacy at MIT Medical. However, just like around the corner really from the MIT Campus Welcome Center is a shiny brand new CVS that many of our students use for their prescriptions and prescription refills. Other students, depending on sort of where they live on campus, might use the CVS in Central Square. And I mean, there's CVSs and Walgreens all over the place, but Central Square has a couple of pharmacies. And then for those students who later in their MIT experience might live on the Boston side of the river, they too will use like a CVS or a Walgreens. And for many, that actually works out really well because their prescriptions, once they're in like the national CVS database, it's very easy for them to pick them up at the local CVS where they are for school. So I know I do that with my own daughter who is at the University of Wisconsin. That's how she gets her prescriptions when she needs something. So
there's a
all right,
question.
Sean, there's a question for you.
Yeah, happy to speak to this. So yes, there's a question here, and I'll read it about our sports medicine practice and if it encompasses care with MIT athletics. The short answer to that is yes. We have 4 of us that are primary care sports medicine trained team physicians here at MIT, and 2 orthopedic surgeons who partner with us in our practice at MIT Medical. We do partner with both varsity athletics and club and intramural athletics with our sports medicine partners within the Department of Athletics, Physical Education, and Recreation. And we also have a clinic that is once a week in the athletic training room that coordinates with our athletic trainers and our student athletes. But have a pretty strong and robust service in that area. Happy to give more detail, but we're very integrated and partner strongly with our teams and coaches and our athletic trainers.
All right. Any other, Brian, was there anything that you, or anyone on the team that you saw come through in multiple questions that would be worth addressing verbally rather than just typing? Yeah.
Sure. I think let me answer one that we often get, which is there's actually one in the Q&A right now. We really can't tell you in advance whether or not your plan will meet the requirements at the state level. Those are all sort of custom. We look at all of them with our vendor partner. The best way to measure it is if your plan has a limited network, a regional network, a state-based or local network. Again, the most common examples are Kaiser Permanente in California, great health plan in California, but limited services outside. So the best way to find out is to ask questions. And it's possible that folks might have options as well within your existing plans to have a more nationwide network. What we're looking for is a network that includes a broad base of providers, that is doctors, therapists, hospitals, pharmacies, and the like in the Boston area. That's the standard that's required to meet. We can't really tell you in advance, but if it's regional or local and not around Boston, Cambridge, then it probably doesn't meet the requirements. MIT SHIP begins 9/1, September 1st, and continues through 1 calendar year to August 30th of the following year.
All right. There's a question about whether we have a nutritionist on staff, and I will share with the group that our longtime nutritionist just recently retired, and we are in the process of working to find a replacement. So not at this time, but we do again have nutrition practices in the area that we are able to partner with. Nutrition is generally available, but not currently at this moment, and hopefully we'll have that sorted out by this fall. So any other questions here? Let's see. And then let's see. Sports trainer to help with PT for the varsity athlete, Sean. That one's for you, clearly.
Yep, that's great. I'm actually typing an answer as well. So the answer is yes, our athletic trainers can assist our student athletes in rehab and recovery from injuries. We have also very close a network of some local physical therapy groups in the area, some of which that are essentially near enough or on campus. So for more complicated injuries, post-surgical, where people need very direct one-on-one, hands-on, high service, we will partner with the local physical therapy group. And then certainly our athletic trainers are well-skilled in the rehabilitation of injuries. And it's kind of a clinical need that helps us navigate which one. Oftentimes we're still involved, and our student athletes can get kind of extra by going out for post-surgical and doing some internal as well.
Okay. Brian, can we just
yeah, I can answer that one live.
Yeah, can you answer that one live? And then also, could you just mention for those who might be on a Medicaid plan in their home state, what happens with them? Because I'm not sure if you covered that earlier.
Sure, I didn't, and that's a great one to point out. If you are enrolled in a Medicaid plan that is not Massachusetts Medicaid, which is called Mass Health, that does not meet the state standards, and so those students will be automatically enrolled into MIT SHIP plan. So that out-of-state Medicaid, out of Massachusetts Medicaid, is not going to work for a waiver. The question around a parent losing a job or insurance mid-year, can you get SHIP mid-year? The SHIP plan, like most health plans, have something called qualifying events. That allows you to make changes, come into the plan new and leave. And in general, losing access to health insurance through another party, that would create a qualifying event and allow your student to enroll mid-year. There's another question here, if I can do it, Cecilia, about insurance on out of the country visits. MIT's student insurance plan is a great plan across the entire United States, but it provides limited coverage out of country, specifically around emergency care and repatriation. So if you were in Europe and you were hurt or injured and had to go to the hospital, those will be covered in most circumstances. Getting you back to the United States will be covered in some circumstances, but ongoing basic care would not be covered. In addition, if you're currently a foreign resident, the repatriation is to the United States, not back to your home country. So something else to keep in mind.
All right, and then just there's a question here, Brian, about the cost, whether that was included in the yearly tuition. So no, the insurance is a separate fee that is billed to the bursar account on a per semester basis. So it's not rolled into tuition, is the answer there.
Cecilia and Brian, can I add to this discussion around insurance that might address one of the questions that we saw earlier around insurances, particularly ones like Kaiser Permanente. From a student mental health perspective, if you or your child anticipates needing kind of intensive mental health care here, like for instance, off-campus behavioral health weekly therapy, I would highly recommend steering away from your local insurance, because the provider network in this area is robust, but they often do not take insurances from out of state, and they're very familiar with many providers do take the student health insurance, which is a Blue Cross plan. So Blue Cross is very popular here in Massachusetts, and so if that's something that you're anticipating, I would recommend that you think about carefully weighing that into your decision about what insurance to use for your student.
All right, Brian, I think there's a couple more in the insurance flavor that you might want to address as well.
Yeah, always lots of questions about this. So let me answer if my child enrolls in CHIP, can she keep her home state insurance? This is complicated. Health insurance is one of the few things where more is not necessarily better. More often can lead to confusion in something called coordination of benefits, where the healthcare provider will try to figure out which of those two plans is primary and which is secondary, and it can get a bit complicated. In general, we don't recommend that students enroll in both the SHIP product and stay on their home insurance longer than necessary to sort of run out whatever that current enrollment period is. It can happen. There's no prohibition against it. It's just recommended that it's not necessary, and it can sometimes be a little bit complicated. The cost of the MIT student health insurance plan, I'm looking it up as we speak. Hold on one second. We have not published next year's rates yet. We're working right now with our team of actuaries to figure that out. But for right now, the student premium for one full academic year, that's September 1st through August 31st of the following year, is $3,089. $3,089. And that's for the SHIP plan for the full year. That will likely change next year. I don't know how much yet, but we'll be publishing that on our website as we move into the summer.
All right, and then there was a question I think Sean might be typing an answer to, but I will take a moment just to address that, which is if my student has a cough, cold, flu symptoms, which is approximately 50% of the visits that a student might make to us, typically through our walk-in urgent care service. Will we bill their home insurance? And the answer is no, we will not bill your home insurance, because that is the kind of service that is fully covered at MIT Medical as part of the tuition. So we would not bill your insurance unless there was some expensive send out to a laboratory test kind of thing that came out of that. But other than that, you would never see that hit your insurance. All right.
And Cecilia, maybe just to highlight that there are no co-payments for students in the building, right? So if people have co-payments as part of their health plan, there is no additional cost to that. And MIT Medical does not, maybe the easiest way to describe it is it does not bill the student health insurance plan or home insurance. It's factored into care for students on campus, just to round that out.
All right, and then I do think it's actually just worth talking about, we're talking a lot about the health insurance, and we are very pro the MIT Shift plan for our students, because we know that our students who are covered under that plan have a really excellent and comprehensive plan that covers everything they could need while they are with us, and in some cases is much better than what you have on your insurance from home. And in particular, I would highlight, for example, the behavioral health benefit, where students can get an out of MIT Medical referral for behavioral health services, and they have a covered benefit of 52 visits per year without a copayment. Okay. And that's unheard of, actually, and none of our peers even cover that many visits. But we have, view that as really important to make it so that there are no barriers to care for students who need that kind of care while they're at MIT. So that's an example of how we try to provide value through our health plan. We also, in the same behavioral health space, antidepressant medications, basic kinds of medications that folks might be on, those are also covered at no cost to the student. Correct, Brian? Like the,
Generic
Prozac and
antidepressant medications.
generic
are covered.
antidepressant medicines are covered at no cost. So those are things that we have built into the plan design to make it easy for people to get the care that they need. So, and then, I think one of the things that's really important to consider for Sean, Sean and his team, when they're caring for athletes who are on home insurance versus our insurance, if that student athlete has an injury during an event or a practice and they need an MRI, that is an example sometimes where we get into a complicated, insurance prior authorization situation, depending on what the home insurance covers and what's in network for things like advanced imaging. So, we don't ever want to be in a position where a student has to leave campus to go back to Maryland to get their MRI. They're too busy while they're at school, and that's an additional stressor for them to have to get those kinds of services back at home. So.
So can I take an interesting question about MIT student athletes who arrive earlier than 9/1? This is related, to those of you in the know, to NCAA requirements regarding health insurance. We have arrangements in place with our partners at DAPR, as Sean mentioned, the folks who help to partner with us on student athletics. And we have a solution for that problem, and we can work directly with your student and with the coach and the athletic department folks to make sure that happens. So not to worry.
And so there's a question in there about getting a mental health appointment. We've worked very hard to try to lower the barrier for students to get in to see us. And so it's pretty easy to get an appointment. Your student, all they have to do is call. And what will happen is that they'll get to talk to one of our clinicians, and they'll kind of do a brief kind of screening over the phone to see what their kind of needs are and come up with a plan, which is often the next step is to schedule an appointment. We have this year also an option for students to sign up online to receive that phone call. We were finding that students have appreciated the ability to sort of pick a specific time in their busy schedules rather than kind of playing phone tag. So that's another way for them to set up this appointment. And our wait times are typically for the initial intake anywhere between 2 and 3, sometimes 4 weeks during the busiest times of the year. As I mentioned earlier, though, if we have a walk-in service, so if your student is waiting for that initial appointment but needs more urgent support, they can get that through our walk-in services while they're waiting for kind of like their permanent clinician.
So maybe I can answer a couple questions. We've had a run of questions on using SHIP at home. So for those of you who have experience with health insurance, it's a PPO product, which means that it is pretty open in terms of how you can access care. You don't have to have, in most cases, a referral from your primary care provider. You don't even have to have a primary care provider, but we're strong believers that primary care providers are really important in coordinating care. So it's a nationwide PPO Blue Cross Blue Shield network. So any Blue Cross Blue Shield nationwide PPO provider or hospital is included, and the benefits, so the copay you would pay or any of the deductible inclusions would be exactly the same as if you were seeking care in Boston. So it's a nationwide product with a single set of benefits for any in-network Blue Cross Blue Shield national PPO provider.
And Brian, I'll just highlight that oftentimes that is equally as important when students are doing internships or other things in different parts of the country that aren't home, but just to put it there as well.
Yeah, and maybe Sean, there was a question I know you answered in the Q&A about urgent care and what it's like to come to urgent care. Maybe you want to do that sort of verbally as well. What do we offer?
Yeah.
How do you do it? Do you call? What are the options?
Yeah, happy to. So we do utilize an online scheduling or reservation system. There is a link right on the MIT Medical homepage for urgent care and to reserve a spot in line. It will show available time slots that people can choose. We do accept walk-ins as well, but for flow, for timing, for ease of scheduling, it is advantageous if people, for both our community member, but also for our urgent care service, if individuals are able to utilize that process to be able to streamline the flow of patients and keep the throughput going. But it is relatively simple, quite low barrier, and certainly want it highly available for our patients and students.
For context, I'm checking live right now. We have about a 15-minute, between a 15 and 20-minute walk-in wait right now, or you can book an online slot starting in about 20 minutes.
And I'm just looking at this question, Tony, which I know you're typing in the answer to, but I will, I'd like to answer it from a couple of perspectives. I myself was a student athlete at MIT many eons ago, but MIT was not easier then. It was hard then, and it is hard now academically. And it's a very time-consuming place, both on the academic front and all the great activities that students like to become involved in when they come to MIT. So my viewpoint on that is I will say that the one semester of my entire 4 years where I did not play a varsity sport was my worst academic semester of the 8. That is my personal experience. Not playing sports did not lower stress for me because my whole life had been sort of designed around practices, games, that sort of thing. And when that's part of your routine and what makes you feel good, taking that away in the sort of, at least in my case, misguided attempt to spend more time studying is not as often successful as you might think it might be. So,
yes,
Sean is also, he was a Division I student athlete. So.
Yeah, and I've cared for MIT student athletes since 2005 and as you can imagine, get to know many of our athletes quite well. And many actually will say the same thing, that the structure and regimen that they're used to really helps their studying. And then between procrastinating or trying to do other things, they find that they have a little harder time organizing. Now, certainly there is that balancing act of time when they're, at peak season, time of seasons and contests and midterms and all of that. And Tony, maybe I'll let you talk a little bit about the service and any of those components as well. And also community wellness can be a resource as well, with oftentimes our community wellness program managers will do talks for some of the coaches around sleep and around habits and healthy habits. So But there's a big answer here.
Yeah, I had written in the chat that we don't have specific data on our students, but and I think it can be difficult to make kind of a broad generalization about the benefit because it can be very individualized. But participation in sports can have both benefits and it could also present challenges, just like participation in any other activities, clubs or things like that. And I think what's important for you and your children to know is that is to check in regularly with oneself about all their activities, their academics, and to try to find that balance. And to recognize when too much is too much, and to try to scale back where one can. I think that's probably a more generalized approach to kind of healthy living at college.
And I think on that note, thinking about the healthy living at college, we hope that you want to check in with your students while they're away at MIT. Like most parents, you're going to want to do that, I think. But there is also a fine balance there too. And the key thing is to be checking in with them and being supportive, but not trying to overly manage their time, their success in the classroom, whether they're getting their problem sets and things done. This is a really important time for them to learn to manage that stuff on their own. And I think having a lot of external pressures they have enough internal pressure on themselves to do well when they're at MIT. And when there's additional pressures placed on them from people from home and other parts of life to take this set of classes or declare that major or have this level of a GPA or that set of activities, it really hinders the abilities for the students to really, I think, find their way on their own. And it creates additional stressors that it's hard for them to manage, frankly. And I think Tony would agree with me that that is a lot of what he and his colleagues, I think, work with students on, is that the student does not want to disappoint anyone. And especially they don't want to disappoint themselves. But next to that is probably parent from home, I would imagine. And it's really hard. You have to just take your foot off the gas and get in the back seat and stay there, maybe not even in the car. So I don't know, Tony, would you like to expound a little bit more on that?
No, I think you said it well, Cecilia. I think that is one thing we do often see and help students try to navigate is trying to find that balance. MIT students are very driven and have a lot of energy and excitement. And sometimes it's hard to take the foot off the gas pedal a little bit and zoom out and see just how much they're doing is affecting their health. And it can be, and that's where I think parents can also be very helpful, is to be able to have that perhaps bigger view and help students come to realize, like, slowing down is okay. Doing less is perfectly fine, and you'll still get to where you want to be, and you'll still graduate.
Thank you, Tony, for chiming in on that. It's something I'm actually really, I think, passionate about, having watched my own student on her journey through MIT. We want you checking in with them regularly, but not daily. And you shouldn't be asking them about things like, well, how'd you do on that test? Because that just continues to, if they share with them and say things like, well, how can I support you in that, if maybe the outcome wasn't what they expected? Because for nearly every student, probably sometime in their first semester, they will have an outcome academically that they didn't expect. And most of these students have not had an outcome, an adverse academic outcome prior to coming to MIT, is the other thing to remember. But you should expect that they will have grades that are not as good as they were in high school. And there's a reason for that, because MIT is not high school. So, any high school. So this is a really great question. How do you check in with them without letting them feel like they may be disappointing you? Any tips on how to start the conversation? I think one of the best things to do really is before your student even comes to MIT, just to say, look, student, we love you. We want to know how you're doing in your life, and maybe just set up an expectation that they call you on Sunday afternoon every week. Good, bad, or otherwise. Like, is that just part of their routine? Is that they call home on Sunday, or you're allowed to call them on Sunday, or you FaceTime on Sunday? And so that way, it's just part of the normal routine that they're in, and it's not it's not so much around what is going on in their life. It's just that this is when we check in, and you ask simple questions like, how's it going? And then wait for them to, look at open-ended questions to see what you get. Is there anything we can do to support you? Is there, but really not, I think, going deep into things like, well, how many friends have you made? How are you doing in your classes? Are you, you might want to check in a little bit about, are you getting sleep at night? That one we would appreciate if you check in about. I think that's a really kind of a good one to ask about, but just, how are you, just a basic one, and then share with them what's going on at home. Send them my daughter in college, her favorite thing is to get text pictures of our dogs. She doesn't really want pictures of us, but she loves to see the dogs. The kids miss their pets. So there are ways that you can show them that you love and care without really making it be about like how they're doing in school. So hopefully that was helpful. All right, well, I think we are at time, or at least what we had sent, and there are no more questions in the Q&A. We thank all of you who decided to join us this afternoon, or I guess depending on where you are, it could be morning or evening, to hear a little bit more about MIT Medical. You will be getting information from us over the summer. If your student chooses to attend MIT, that will they will get information, and you will get information. A lot of it is around obviously the insurance enrollment process. That is one thing that we just want to remind you, that there is a deadline for the waiver process, and we hold firm to the deadline. And so it's one of the things you do need to be checking in with your student on before they come to MIT, because they have to initiate the process. It's not you. So that is really a critical point, that if you are not intending to enroll in the SHIP and you need a waiver, together you need to work to get that done by the deadline. So that's just one key point. We get quite a few distraught people after the deadline because the ball got dropped there. So, but in any case, this information will be available. We have a lot of great information on our website, medical.mit.edu. There's a whole section on the students. Just navigate right there, and you can learn all kinds of things about the services we offer. You can see some profiles of our providers, and look at the great stuff that Community Wellness offers. And we are looking forward to meeting some of you and your students at Campus Preview Weekend in a few weeks, and then hopefully as folks get started with us in the fall. Thank you, everyone, and thank you to the MIT Medical team for joining us today, and have a wonderful afternoon.